Welcome to Mastering Modern Midlife. I'm Katherine Grace O'Connell, and this show is powered by the Forever Fierce Revolution, an incredible group of midlife women who are over there on Facebook. So I'm delighted to introduce my guest today. Dr. Doug Mest is the founder and medical director of Pier Medical here in Hermosa Beach. And I am so grateful that I found you through my friend and online and all my research. You're the guy to go to.
Thank you. I'm happy to be here.
And thank you for decking out in all of your, medical attire today.
I wear it all the day. Pajamas every day. It's great. It's a great life.
Do we have any needles stuffed in any pockets at the moment?
Unfortunately, I did not bring it. It's a common question. Sorry.
Well, I already had my pokes recently, and we'll kind of get into that, which is why I had, mentioned to Andrea and reached out to you because at 57, I've been sort of au naturel and coming back from Lyme disease, and we'll get into this whole facial wasting, but I really was like a walking skeleton, and I've come back naturally to some extent, but I look in the mirror and I'm like, I look a little more tired than how I feel, and I kind of want the outside to match the inside.
And that's actually what I feel I specialize in, honestly, is that inner beauty matching and that inner youth matching the outside. And there's really nothing unnatural with how we can now treat patients. And you had mentioned about the Lyme disease and the medical condition causing facial wasting. And that's actually how I got started in a lot of this.
Well, let's go there.
Got known for and doing some of the preliminary research in a product called Sculptra, polylactic acid, which naturally builds your own collagen. Some of the original treatment in patients who were HIV positive. So they had a medical condition that caused them to lose all their fat. And this was 20 years ago now. And that's how long I've been doing
wow,
this.
20 plus years, and you look like you're 20, so that's amazing.
This is real gray. And so those patients had lost all their fat, and they wouldn't go out of the house, and they wouldn't be employed, and it really was life altering to be able to treat them with this large volume restoration. Before that, we used to just treat a line and a fold. And so from that then came the understanding and experience about volume loss that occurs due to natural aging. And so with you probably had a combination of the Lyme disease causing the facial loss, acceleration of that normal aging process. So the volume loss that we see as we age is sort of accelerated in certain disease conditions, but certainly present naturally as we age.
Right. I did. It accelerated everything. And even though, like I said, some of it certainly came back, I don't have as much as I did, but I still have probably more than I would have if I hadn't gone through that experience. And I've not tested the Sculptra. I did recently do Botox, and you guys are going to be lucky enough to see my before and after pictures.
You did
and
Botox or Dysport?
I did. Oh, sorry. I did Dysport, didn't I? You're right.
It's okay. I don't work for either company, so it doesn't matter. We talked about it like it's sort of Botox sounds like Kleenex, but Botox and Dysport are actually different. So I'm glad you brought that up. I had Dysport, which is it affects the face in the same way, but it's a little bit more natural, a little bit softer.
Okay, so let's start with that, because I obviously just had the experience of it, and you guys will be seeing the pictures. But I had wrinkles all up and down. My whole forehead moved, and they're all gone now. And around my eyes.
So, and soon, I think probably in about 6 months, we'll have another neuromodulator. So there's actually currently 3, soon before. So there's going to be lots of options. So it's important to find someone who is experienced. And to me, it's all about the anatomy. And that dictates, we all have similar anatomy, but everybody is, so you look in the anatomy textbook, it's like, it's here, but that's not exactly how it is. Everybody is slightly different. So you've got to look at the patient's anatomy, aging, and then pick the right product, for them.
So we have Botox, Dysport, you said
Xeomin is third, and then there's going to be a slightly longer acting neuromodulator. So the category is called neuromodulators, and they all work the same way. They all work by decreasing the release of a neurotransmitter called acetylcholine, not to get too scientific, but basically they prevent the muscle that causes the line from forming, they decrease that motion. It's actually really interesting because people go, put it here to raise it, and that's actually opposite of how it actually works. And so it's important to have that anatomy and the concept of the opposing muscles and how they interplay. It's all about the interplay to get that natural look without being overdone, without side effects.
You've been doing this for over 20 years, so obviously you've had a lot of experience, and the whole field has changed dramatically.
Dramatically. When I first started, we had one filler, and it was bovine collagen, and it lasted anywhere from 2 weeks to 2 months.
Wow. That's
people had
definitely a dramatic change, right?
And we had 1 or 2 lasers, and they ended up burning more people than they actually helped. But we now have 15 plus fillers, all with different sort of properties that we use in different areas, and it continually, evolves. And so it's a very exciting field.
It is exciting. So I'm obviously 57. I went in, had my consultation, and I love what you said at first is like, what bothers you? What do you want to change? How much younger do you want to look? 5 years, 2 years? Obviously not 25 years, so I do all this crazy stuff. But I love that you cared about how I saw myself.
I personally always say to patients, the worst consult is somebody comes in and they say, tell me what I need, because I don't think anybody needs any of this. It's really exciting that we have these options. And so if their patient says, hey, I don't like this line, okay, here are the options, A, B, and C. Here's the cost. Here's how long it lasts, the risk benefit, all that sort of thing. Because this is still the practice of medicine. So you still have things that can go wrong. So you have to have an informed, consent and knowledge about that. And so it's not my role to say, hey, does this bother you? And then you go, oh my God, it didn't, but now it does.
Now I see my face is crooked and I'm looking at this.
I don't go around looking at people's faces and go, God, that is really awful. Everybody has a different thing that bothers them. And oftentimes somebody will say, hey, this line here, and I can't even see it. And I'm like, why? There's nothing to treat in those patients. And so I will sometimes turn patients down. If they have these full lips and they want to be bigger, and it's like, that's not my aesthetic.
You have a very natural, artistic way that you approach everything.
Everything is driven scientifically by the anatomy, but that anatomy then has to be done in an artistic manner.
And we sat and talked, before the show, a lot about a woman's self-esteem or self-confidence, self-esteem, the way they feel about themselves, the way they look really affects the way they feel.
It's not being vain or anything like that. It really does impact, I think, their overall well-being.
And you said there actually are scientific studies showing that.
Yes.
So please share, because, I think depression is, I don't want to say universal, it's just common. I think most of us have experienced it at some point in our lives. And who knew that something as simple as injecting, a Botox or a Dysport could actually impact the way we feel about ourselves when we're feeling depressed?
When you look in the mirror and what you see is reflected back, and equally as you, the way you express yourself to other people and their feedback to you is really important. And that's the science behind it, is that you get that feedback of positivity. And patients are clinically less depressed.
Yeah, when you were talking about like the facial wasting, and when I had Lyme disease, I remember being embarrassed to go out and being embarrassed to be seen because I was so sunken in and so skeletal, and I'd feel like everyone's eyes were on me. I'd feel so weird.
And so I can't tell you the number of letters and cards that I would get from patients saying, that this has changed their lives. They're back to work. They're, less depressed. That's the extreme of things. But that same effect is, I think, a common thread.
So we have an audience all over the world, but a lot of people here in LA too. How do you know when to start? How do we know what I need? How do we know to find the right doctor, the right match? Like, where do we begin?
So that's an interesting sort of controversy in aesthetic medicine about when to start. Is there an anti-aging effect? If I start, one of the neuromodulators, Dysport, Botox, early, will I prevent the wrinkle? The answer is probably yes. The other anti-aging effects, to me, start simple. wear your sunblock. Don't smoke. Those are some of the, have a good diet. Those are probably the most important things. Personally, you start when it bothers you. And if something never bothers somebody.
Right. It's going to be different for every person.
Once you start to have sort of etched in something that is not changing, it's probably time to start treating the wrinkle. So if you have a line that, for example, a baby has a nasolabial fold. So having the presence of, folds and things like that is not abnormal. Okay. It's really about the contours of the face. So if you starting to have contour irregularities or lines that are creased in and that don't go away when you're not smiling, that's the time to start.
Exactly. And like you said, if it bothers you, because I know I'll look in the mirror and I'll go like, oh, I've got those smile lines. It's great that I smile a lot, but you know what? It's definitely causing lines. Or as I've gotten older and I have TMJ, this part, which I think is natural, starts sinking in and you go like, hey, I want that. I'll do what my mom was doing. My mom walked with her hands like on her face like this until she got a facelift. She held them up and I do that.
So one of the things back to the facial wasting that occurred is that we really started to look at lines and folds in a completely different way. We used to have a filler that filled that line. Well, if you only have one thing, everything starts to look the same, and you use that same instrument trying to do different things. So facial aging is multifactorial. And it starts at the very base. So we have bone loss that occurs. So significantly more in women than men, and tends to occur after age 40, hormonal changes. And so there's osteoporosis everywhere. There's bone loss that occurs specifically in the jawline and the mandible. So we would have what was a normal drape of the skin, and now it's
starting to gravitate a little downward.
And then fat loss and redistribution. The fat pad that used to be up here is now rotated down, so we've got a hollowing up here, so the contours. And all of that infrastructure is what's then causing the outside appearance. So that line and fold is not the primary defect. The primary defect is what's beneath that. And so if you just try to treat the line on top, A, it's not going to last as long, and B, that's when you start to look a little abnormal because you're trying to fix something, but you're not really fixing the problem.
You can actually highlight that area and like do the opposite of what you're trying to achieve rather than,
if you try to push
out
something in one area. And I think that's one of the things that people talk about all the time of, I don't want to look fake or abnormal. And that's when we do try to push it, so.
Speaking of fake and abnormal, social media, how has that? You've been in this world a long time.
Before there was social media.
Before there was, me too. No computers and college and all
life
that.
Life did exist before social media? Wow.
Yeah, it's crazy. But I would love to be able to dial it back without, I think it's wonderful in many ways we can connect to everyone, but this filtered world and seeing 20-year-olds with their faces filled in plastic surgery. So what do you see with the impact of social media?
So the biggest thing is patients will request certain things. You go, why? Oh, because that looks, good. So you want your lips done a certain, way. And lip filler over years has evolved and changed into what is in. And so,
so what is in now?
So Angelina Jolie at one point was big and like a 1-to-1 ratio. The upper lip was almost as big as the lower lip. And that's not normally, it definitely depends on ethnicity, but that's not the normal ratio. Now what's changed is everybody wants just the midline, just the inside part filled. So you have this very pouty look because on Instagram.
Oh, interesting.
That looks interesting.
Interesting. Okay.
That changes based on things. So that's one of the biggest things with Instagram.
Like every once in a while I'll read in a magazine and I'll say like this plastic surgeon sees this person bringing in more of this person's photos. Like who's the photo of the day? Who is the most popular?
So Kylie Jenner's lips is the lip person. There's a big, no pun intended, push for butts.
Kim Kardashian still had an impact there. Okay.
Huge.
Huge. There we go.
Impact, yeah.
Yes. But that's not your area.
That's not area.
Yours is more cosmetic rejuvenation up to a certain point.
When we do that area, so one of the materials, Sculptra, great for contour irregularities, cellulite, that sort of concept in the buttocks. not for really huge volume restoration. I'm not the guy for that. It's too costly.
So how do you know when you need cosmetic rejuvenation and when you cross over into needing more invasive things like eye lifts or?
I think the expertise of the person you're going to and the honesty of that person, because there's a lot of not scrupulous people out there, to be honest with you. And so as great as these things are, they're not, perfect. And if you do try to push some of these things too far, that's when you start to look abnormal. So I think it's up to the provider, the aesthetic provider, to be honest with you and say, you know what, I can get you this far. But if you're, if somebody comes in and goes like this, I go, let me refer you to my colleague, the plastic surgeon, because that's actually a surgical.
Well, I would assume looking at their gallery and seeing sort of the before and after, which we're going to be showing those fairly soon, before and after pictures gives people a sense of your aesthetic and your artistry.
And the biggest, you said, your friend had referred you to me, which is actually the best way that for personal references always best.
Right. And we definitely don't want to end up on Botched, and we'll get into that one too.
Exactly. Lots of stories there. So, Dr.
Mest, I have some pictures here. Pictures. Oh my goodness. Not my own before and afters quite yet. Like the whole but we had talked about, a couple of ways to find the right person is personal reference, but then also taking a look at your website and, the before and afters and the work that you do so they can get a sense of how natural or not. In your case, very natural.
Very natural.
So I'm going to show you a few pictures. You guys are going to be seeing them up on the screen as we talk about them. So tell me the story of this woman.
So Sherry is super, super sweet. One of the sweetest people you'll ever meet. Gym teacher out in the sun a ton. Has been bothered by melasma for years.
And you want to explain what melasma is, just in case?
Melasma is a pregnancy mask, hyperpigmentation, definitely hormonal. It's almost like diabetes in terms of being a chronic condition. It's not curable, and but you can do things to sort of keep it at bay, under control. Okay. And so we have this great new peel that has come out, and very effective. You do it in the office and you wear it home a little bit. And she's been because she's tried a zillion things.
It's really a remarkable difference. It's just brighter, like this luminescent. Now, with peels, you have to be careful that you don't peel too much.
So you have to know which peel you're doing. So there's multiple peels, just like there's multiple lasers. When somebody said, I had a laser done. Well, laser just means one wavelength of energy. So there has to be a target to the laser. So just like with peels, is it a peel that is beta salicylic, where there actually is peeling going on? Is it alpha hydroxy, where it's just internal? So different peels have different levels and ingredients to them.
And so you've been here for so long at this practice at your artistry for over 20 years. So you have had experience in pretty much every peel that's out there.
Yes, and some peels come and go, and some peels come back in vogue, that sort of thing. So there's a new peel specifically for pigment and refreshing.
And you'll know when somebody sits down across from you and they say, I want a peel, or you start getting that conversation.
I usually say, tell me again what bothers you, and then I'll say, okay, here are the options. We can laser it, here's the downtime. We can peel, here's the cost, and that gets back again to the expertise of the provider sharing with you that knowledge for the best outcome.
Perfect. Well, I can see an enormous difference. I think she looks fantastic.
And most importantly, she's really excited.
That's most important. So now we have a woman that looks dramatically different. Now, I don't know what her age is.
So, believe it or not, she's actually in her 70s.
Okay, so she is in her 70s, who you see up there and what is her name?
Shelley. Who actually works in my office.
Shelley works in your office. Okay, she looks amazing in her 70s.
I think she works so she can have some treatments. No, I'm just kidding. And so she's had a couple of things done there, but there's a new hyaluronic acid product. So it said that we used to have one product, and now we have 15. So, which product and where is really important. So we have products that are sort of stiff, and so they're good for projection in the midface. We have products that are more elastic, so they're good for the mobile areas, because historically we had one product, and then that product became the next product. And so there's an evolution of these things. And in years ago, when you were filled sometimes with a stiff product in a mobile area, it looked great when you were at rest, but then when you moved, it sort of went, oh, that's a chunk moving. Now we have these great elastic products
that move along with you.
That move along with you, exactly.
Well, she looks dramatically younger.
And herself.
Yeah.
Telling you, I don't want anyone ever to not look like themselves.
Dramatically younger from a standpoint of the picture. She looks exactly like, but just youthful. Yeah. Everything has changed. Yeah. And what have you noticed because she works with you? What have you noticed in her confidence?
It's her confidence and to patients who come in and go, oh my God, you look great. What'd you have done?
She's a walking advertisement, a wonderful one. So we were talking earlier before the show about the eyes. To me, when I look in the mirror, the first thing I notice, other than this, really is my eyes and the lines, but the drooping and the light. Our eyes are so important. It's the first thing other people see. It's where we first, I think, start to really show aging, but it's also the windows of the soul.
The windows of the soul. That's exactly right. So the eyes are a very tricky area in that the anatomy of the side. Remember, we talked about anatomy. It's all about the anatomy, understanding the anatomy. So the eye area, very thin skin, very muscular. We have the eye muscle that's moving all the time, and bone. So any imperfections are going to show. So we only put hyaluronic acids under the eye because we have an enzyme to dissolve it if there is an issue. Under treatment is to me, a must. I would much rather go, wow, that's really much better than going too far and go, ooh, what'd you have done? If you make them too puffy, it doesn't look good.
All right. So the next patient we're talking about looks very, very young to me. And what you guys are seeing up there are the eyes. The focus is on the eyes, which are really the windows of the soul. And to me, the first place we really see aging.
One of the first. And so she is, in her early 40s. So young.
Yeah, she looks
as I get
very
older,
young.
Young is younger.
Young
55.
Exactly.
So.
It's all relative and all.
But you have to, the under eye can be a very tricky area to do. The anatomy of it is such that you have thin skin, bone, a lot of muscle activity. So there's only certain products that I personally feel safe to put under the eye. And a little goes a long way. We want to get an improvement without having it be overdone. But she looks way less tired there. For the right patient, it's a significant improvement.
Yeah, you can see that she looks the same, but just so refreshed. Like she got a really not a goodness. Yeah, exactly. But every day to wake up feeling that way. Every once in a while we get one. So moving on to the next one. This seems like a typical woman at midlife and beyond, where you have that sort of crepiness and that sagging and
so back
thinner
to
skin.
This thin skin where in the past, you had products that were very stiff. You'd see them, it didn't look good. So now between a product like Sculptra, where we can actually improve the collagen and the infrastructure, tell patients that Sculptra is like the 2x4. We're doing when we're remodeling the house, we have to have that infrastructure.
I'm looking forward to getting some 2x4s.
And then we need to oftentimes put a little bit on top. So that's the effect of Sculptra and a new product called Refine. And that's that elastic product.
And how old is she?
So Mary is probably in her 60s. I honestly almost never look at somebody's I don't go in their chart and look at their age. I really don't.
Yeah, I'm just curious as far as letting our audience know.
That's Hannah's mom.
It's Hannah's mom. Well, she looks absolutely lovely. And what I'm seeing is, I grew up with half Irish heritage, so the skin it's a lot thinner than somebody who has maybe German skin where it's thicker and oilier. So you might show aging prematurely.
Sure.
All right, so let's go into the last one here. And I noticed a dramatic difference. So what did you do here?
So we did a couple of things, Sculptra, and then product Define. Her wrinkles and laxity were a little deeper. So there's Refine and Define, very sister products. Okay, and we pick which one I want to use based on sort of the depth of the fold, the level that we're injecting it. And I think she again looks like herself. Super happy.
She looks beautiful. You talked about cool sculpting.
Cool sculpting is where we're freezing the fat. And so when it first came out, it was, we're just going to do an area of love handles. And now we're actually doing more treat to complete. We're taking an area, the whole abdominal area and treating. So great for patients like myself, age group, where if you have liposuction at a certain age, you just suck the fat out quickly, then the skin is going, whoa, what's going on here? There's nothing to support. So with cool sculpting, the fat's frozen and killed instantaneously, 25% in any one treatment. But it takes time for the body to resorb it. It takes time for the body to then give the body time to actually retract, the skin to retract.
There are so many choices out there. It sounds a little overwhelming, but I'm really glad. That's why it's so important to go to somebody like you who's been at it for 20 years, has experience in so many different things. And also, you said, has this personal connection to the person sitting across from you, create a more family type relationship where you really care about them and their well-being, it sounds like.
We do. It's really an honor when patients allow me to go on the journey with them, to help them, because they're always a little frightened. You know, they're excited and frightened at the same time.
Pull out those needles in.
Not even frightened of the needles.
I'm teasing. Yeah, because you don't know what I want to look like me, just a younger version of me. And then we see those scary, we talked a little, just mentioned it on Botched, which Botched is the show that you have been an anesthesiologist on. And Botched is the show that you don't.
So my original training is in anesthesia pain management. I graduated med school over 30 years ago. I'm really showing all of my age. And we didn't have this whole specialty of injectable aesthetic medicine didn't exist then. So I won the anatomy prize in my med school, which is I always come back to anatomy. To me, it's all anatomy and artistry together, and the using a needle and a syringe and lasers and other things to accomplish that. And it's an exciting time. Things keep changing. We keep just this week added another procedure to our practice called Aqua Gold. So next week there'll be something else.
There will be something else and something else. So how does a woman know if it's rejuvenation she needs, or is it plastic surgery, something more invasive?
We can do a lot. And again, more each, year. We're still not doing, surgery, meaning there are still certain limitations. We don't have great treatments for the neck sometimes. So sometimes it's obvious. It's like, I can't really help you. That's too far gone. And then I have had a number of patients who I would say, you're too far gone. And they go, I'm never, ever having surgery. And I've gotten them to be, happy. And so that sometimes is an individual decision.
It's very personal.
But when would they know? I think you have to talk to somebody who actually has experience in the field.
Well, I'm excited to keep going down this path with you. Obviously, like I said, I had Dysport. So I had some Dysport around my eyes, and we went really natural and really light. And then on my forehead, which you guys will be seeing the before and after, I had a lot of what you call sort of Sharpay. You guys didn't know because my bangs have acted as Botox hiding those wrinkles.
I don't have bangs to hide mine.
I did. It was one of the things that really, really bothered me. And I would honestly, when I was a child, I had a high forehead and I was teased for it. So I used to scrunch my forehead to shrink it, and causing lines that I didn't realize. It's so interesting what we do to ourselves. So I had more lines than probably the average person. So tell me, budget-wise, we have many women out there, many different ages.
You just mentioned the B word.
The B word, the F word, the B word. So budget. So if a woman lower, mid, higher, off the chart celebrity.
So like I'm fond of saying, no one needs this. So if somebody's coming in and they're going to not feed their kids or not, don't do it. It's not. That's the biggest budget part. Most of the patients in the U.S. start with a neuromodulator, Botox, Dysport, that sort of thing, because you're in general looking in the hundreds of dollars, range. I would say money is not the only thing. Don't go for a Groupon or the lowest cost.
Yes.
And the materials to the doctors cost a certain amount. Meaning if you find something for too low of a price, it's probably not real. It's probably not made in the U.S. It's probably, imported illegally.
You get what you pay
so
for.
Careful
be careful
of the final cost aspect of it. So, but anyway, to answer your question, so the neuromodulators, depending on what areas you're treating, are we doing neck? Are we doing crow's feet? You know, how many units? And so we charge by the unit in the office because that's the fairest way to know exactly what you're getting. So historically, some offices, we did an area. We're like, how much is in that area? How much did I actually, use? So neuromodulators for the biggest bang for the buck. Okay. And then your fillers really vary depending on the longevity of them. Okay. So we have fillers that last anywhere from 6 months to, actually 5 years or more. And so the longer lasting,
the more the cost, because it's kind of cost average.
Yeah. And that's actually how they're priced to the doctors from the companies, is how it works. And then some of your lasers, Thermage, that sort of thing, can be in, $1,000, $2,000 range. And the fillers, it depends, again, anatomy, what are we trying to do and where? Are we trying to lift? Are we trying to do a little line? So some of that depends on what the goal is. So I will try to, again, work with someone to say, okay, what is it that's causing the aging on you? What bothers you the most? Let's start with that. Let's continue, to evolve with you.
So we worked out sort of a plan that's sort of step by step and little by little, and showing you guys really the before and the after and the whole transformation. So the next time I come into you, I'm having what's called a Cindy special, which
Cindy's my head nurse.
Cindy's it. She's been there a long time.
She's been there. Makes us sound old. But yes,
she's been there a long time. So tell me what a Cindy special incorporates what's called a vampire facial. Is that right? Like PRP?
So PRP, sometimes a lot of this thing can be very gimmicky,
yes.
And so it'll get into the press and then people run with it, a liquid facelift or vampire facial or whatever. I try to always do by science and do by what's actually, working. And
what's happening?
Sometimes something will be introduced into the aesthetic marketplace. And you're like, that's very exciting, but it only worked on, say, the microscopic level. And when you're actually doing it clinically with patients, you're like, well, that was disappointing. So there's always a learning curve in what's actually, really working. But we're, again, also evolving with what we're doing. So the Cindy special is multimodal approach. So classically, we'd do one laser and go, okay, you're done. So the Cindy special is one type of laser, the 1540, which is a fractional non-ablative. Fraxel is sort of the known name.
Yes.
That was the original.
I think most of us have heard of it.
So you've heard of Fraxel, you've heard of Botox. So, the first to market always has that name, and then there's other, so it's general categories. Yes. Okay. So the fractional non-ablative laser, PRP, which is platelet-rich plasma. So that's harnessing your body's own healing power. So within platelets, obviously when you cut yourself, platelets come along and they start
healing.
Okay, so great, you don't bleed to death, but the body's a lot smarter than that, designed so that it's not just stopping you from dying. You have to remodel and heal that wound. So within platelets are growth factors to help that occur. So what we're harnessing within the PRP is concentrating the platelets for those growth factors. The reason I don't necessarily think like a vampire facial is
that's what somebody had said. So I have no idea.
It's there's again lots of hearing misconceptions, things we read,
which is why we're here to clarify those misconceptions.
And, we have to give the body an injury so that the growth factors know what to do. So just putting PRP in by itself, I don't think personally is that effective. But when you combine it, and this is what we do in the Cindy special, long-winded answer for you, sorry, is the laser, so a heat-based injury. Then we do microneedling, a mechanical injury. So we've injured the body, and now we're giving it the growth factors to have it heal.
So what can I expect as a 57-year-old woman going in there for my first Cindy special?
So the beauty of the PRP, in addition to the increased growth factors and better results, is that your healing is quicker too. So even though we're doing this, you're doing
kind of
laser
all these
and a microneedling,
things.
and I'm going to be red for years. No, you're actually red for a day or so. And a little bit of puffy. If you go around your eyes a lot, you can get a little puffier around there.
Everyone's different. Eye swell.
And that's sort of it in terms of the recovery process. It's
and
not,
what will I
and then
look
what we're
like?
going for so done in a series, and we're trying to increase your collagen, decrease your pore size, help with the fine lines, some with the pigment. So we're sort
amazing.
of resurfacing the canvas. Sometimes I'll tell patients the analogy of we're redoing the painting. So sometimes we need to
stretch
put the stretch.
Canvas,
we have to
pump it up.
We have to stretch it out. Sometimes we have to repaint. We have to do all of that.
Yeah. So you guys will be joining me in this whole journey, and I'm going to be showing you the before, the actual during the procedure, as well as the after and the ongoing sort of impact and effect over time. And it's going to be gradual. Everything I'm doing is really natural. And then I'll be doing Sculptra as well. And I think Thermage, we talked about it's a whole, so we talked about Sculptra. What is Thermage and how does that work?
Thermage is radiofrequency tissue tightening. So it was first to market. So we have the 4th generation machine now. So these things not only evolve, they improve. So people have heard of Ultherapy, which is ultrasound energy. So Thermage is radiofrequency, electrical energy, trying to get into the dermis to heat the dermis to a certain temperature to remodel itself. So when we're younger, our collagen's like this, and when we're older, it's like this.
Yeah, a little more.
We're trying to tweak the body's repair mechanisms. So again, we're heating it. We tweak it so that it repairs itself. And
it's a very natural way to.
So again, all your own repair mechanisms, all very natural. So Sculptra, naturally building your own collagen. Thermage, repairing and remodeling, your own collagen. The key with a surgical the tissue tightening is you have to get bulk heating. You have to give enough of the area to be heated to that holy grail temperature to remodel itself. So certain machines that I've looked at in the past, they don't get enough of a treatment area heat.
So the eyes, as we talked about before, that's probably the thing that has bothered me the most as far as the hooding. But I always had hooding. I always had sort of bags under my eyes and hooding even as a child. It was just sort of genetic. And over time, it certainly accelerated as the fats bulged through and
so the Thermage, we can actually do the eyes as well as
awesome.
The face and neck. So you have to, again, go back to what is happening. So in anatomy, the aging, so the ligament is stretching and weakening, and therefore what you're seeing on the surface is that bulge of the fat over the weakened, ligament.
Well, you guys will be seeing all of this, and I'm so excited to try it, go through the process, like I said, document it all, but really share my experience and the way I feel. Because, like I said, we talked about earlier, I feel very young on the inside, but sometimes I look in the mirror and I'm like, hey, who are you?
Who is this person?
Wait, get Catherine Grasso, that edited version back over here. But I think it's so important in a woman's confidence and
men.
Well, that's true,
I
right?
have to say, the increasing
yes.
male, population having things done.
Thank you for saying that, because I think that's really important. Some of the clips I saw of you, like the man who was dealing with all the wasting, watching him, he was like a little kid bouncing out of there.
It's some of the treatment's transformational.
Yeah.
But just to know, it's not just for women.
Yeah, that's I really
your husband. You can make him come in.
Your husband, and like I said the first time I met you, you were okay. So what did your husband do? Tell me the answer.
He married well.
Yes, he did. Yes, he did. I think he did too. So, no, seriously, this has been such a delight. And it's such an important topic for our audience. And for me personally, at 57, having not really dabbled, I'm dabbling in many different things, and you guys are going to really be coming along for the ride in every aspect of this. And I'm grateful to have someone who has 20 years experience, who's also has a very natural aesthetic here in Hollywood. It is a little scary. So you make it very not scary.
Thank you.
Yeah.
I'm excited for you. It's going to be fun for me.
Yeah.
It'll be fun for you too.
It is fun. Unfortunately, I'm good with needles. So if people want to work with you, be here in the LA area, anywhere in LA, but people probably fly in, I imagine.
A lot of people fly in to see me.
Yeah. So how do they find you? How do they connect with you? Can they have a consultation? What's the process?
So we always encourage a consultation. And any of the consultation fee is applied to any treatment that you have. And so it's not wasted money. And the office is can be contacted 310-379-6074.
And your website?
Website is pieraesthetics.com, PIERAESTHETICS. Wow.
Wow, that is impressive.
That is
oh my God, you didn't have to read your shirt. That's fantastic. Wow. And do you guys have specials if they have a newsletter? Do you have anything like that?
So we have newsletter specials that go out once a month. So it just has to be put on the
it's February right
list.
now. I'm not sure. The show might be airing next month, but so like for example, what would typical specials you offer?
We'll oftentimes combine. So cool sculpting, there's currently $500 off various areas. We'll combine things. We'll do a décolleté special where we'll do Sculptra to help with the lines on the chest, and combine that with an IPL for the color of it.
That's a whole nother show. We're bringing you back because we didn't get into the neck thing. We didn't get into the décolletage. We stopped here, so we will. I have not ever hit that. I grew up, in the sun and reflectors and baby oil, that generation. So
that is what we're all like. What you're seeing now is from 20 years ago.
Exactly.
The damage, and so we all did things in our youth that
we all did.
Right.
So thank you so much for being here and for being, holding my hand through this journey. And I cannot wait to experience these results. Like I said, I'll share the Disport with you guys, the before, the during, and all of that, and the whole process. So
excited for you.
Yeah, I'm excited too. So you guys, thank you so much for tuning in today and for mastering modern midlife along with me. Cheers, beauties. Stay fierce.